Welcome to Practical Foot Pain. This is a series where we take one common foot problem and explain it in plain English. I'm Dr. Thomas Lembo. I'm a board-certified podiatrist, and today we're answering one question: what causes plantar fasciitis? Most people are told they have plantar fasciitis because their heel hurts, usually with the first steps in the morning or after sitting for a while. That description is accurate, but it does not explain the cause. To understand plantar fasciitis, you have to stop thinking about the heel as the problem and start thinking about how the foot is being loaded during everyday walking. The plantar fascia is a thick band of connective tissue. It runs from the heel bone to the toes. Its primary job is structural support, not cushioning. It helps maintain the arch of the foot, and it helps stiffen the foot during push-off. Every step places tension through this tissue. When that tension stays within normal limits, the tissue tolerates it well. Plantar fasciitis develops when the amount of strain placed on the tissue consistently exceeds its ability to recover. That is why plantar fasciitis is best understood as a repetitive overload condition, not a single injury. One of the most common drivers of overload is excessive foot motion, specifically overpronation. Pronation itself is normal. The foot is designed to roll inward slightly to absorb shock. Problems arise when that motion becomes excessive or when it lasts too long during each step. When the foot overpronates, the arch collapses more than intended, and it stays collapsed longer under load. This increases the tensile strain placed on the plantar fascia. Instead of loading and unloading efficiently, the tissue is pulled under strain repeatedly. Over time, this leads to microscopic breakdown near the heel attachment. This mechanical pattern explains several classic features of plantar fasciitis: pain with the first steps in the morning, temporary improvement once you get moving, and worsening symptoms after long periods on your feet. Limited ankle motion often makes this worse. When the calf muscles are tight, the ankle does not move forward easily during walking. The foot compensates by pronating more. That additional motion further increases strain on the plantar fascia. This is why calf tightness is so commonly present in people with plantar fasciitis, even when the foot itself looks fairly normal. Arch support does not help by cushioning the heel. It helps by changing mechanics. In people whose plantar fasciitis is driven by excessive pronation or prolonged standing demands, appropriate arch support can reduce how much the arch collapses during walking. This decreases ongoing strain on the plantar fascia while the tissue recovers. Not everyone with plantar fasciitis needs arch support, but when biomechanics are part of the problem, addressing them often makes recovery more predictable. Samurai insoles are a brand I developed with this mechanical goal in mind. They are designed to support arch mechanics and limit excessive pronation during everyday walking and standing. Used appropriately, arch support is a way to manage load while the tissue heals, not a cure on its own, and not something every foot automatically needs. Many people rest, ice, and stretch and feel temporary improvement. But if the mechanical forces acting on the foot do not change, symptoms often return. The plantar fascia is placed back into the same overload cycle. That is why plantar fasciitis can linger for months, especially when the root cause is not addressed. Plantar fasciitis is not really a heel problem. It is a load management problem. The condition develops when the plantar fascia is asked to do more work than it can recover from, most often due to excessive pronation, limited ankle motion, or prolonged standing demands. Once you understand that, treatment becomes less about chasing pain and more about correcting the forces that caused it. That is where lasting improvement usually begins. Thanks for listening to Practical Foot Pain. I'm Dr. Thomas Lembo, and I'll see you in the next episode.